everyone. We're going to ask everyone to come back from their amazing conversations so we can get started with the final panel before we break for lunch. Thanks, everybody. So I would like to acknowledge how incredible this morning has been, particularly our last panel. And I'd like to acknowledge the vulnerability, the honesty, and the bravery that each and every one of us. Sorry, I know we're having amazing connections and conversations. So I'd very much like to acknowledge the bravery, the honesty, and the vulnerability that our participants and our panelists are bringing forth to this event. The stories that we are hearing and that we are sharing are so critically important to help move the system forward, because it encapsulates our hearts and our minds and motivates us and inspires us and reminds us that even though the challenges are so great, there are so many opportunities for solutions and for hope. And so the stories are so very important to be shared. One of my jobs at the Alliance, which I'm very proud to do, is to develop research projects that can help put numbers behind those important stories. And while the people in this room, in this community, living the issues and finding solutions, are doing this day in and day out, the numbers that research and evidence provides us that are obvious to our community make these issues undeniable to the Canadian public and to policymakers. So I'm proud to introduce our panelists today, Marina, Alexia, and Angela. They're part of the research team at the Autism Alliance of Canada, and they're going to discuss two important projects that we've undertaken that are going to help bring those numbers and that research and that evidence to policymakers. These projects illuminate the gaps in services across provinces and territories. And a critically new important project, how can we measure and report wait times to diagnosis across the country so that this data is out there, and the injustice that we know of children waiting 7 years, 5 years, 4 years for access to diagnosis can start to really be addressed at the national level. Thank you.
Thank you, Deepa. All right, so hello again. I'm going to talk to you today alongside Alexia about a scan of the internet that we did, and it talks about autism programs and services across Canada, and we'll dive into that a little more. So I'm Marina Shore. I'm the research coordinator at Autism Alliance of Canada. I'll let Alexia introduce herself briefly if you'd like.
Yeah, you've seen me before, but I'm a postdoctoral fellow at Autism Alliance of Canada.
And obviously, Dr. Singal is our scientific director. So this has been the main team leading this process, but it's definitely a collaborative effort. So first, I'd like to talk a little bit about the current state of things. So why is this important at all to understand what programs and services are available? We know that there is an inequity in accessing services and supports, especially throughout the lifespan for autistic people in Canada. And we really need up-to-date information to monitor progress and change, especially as national policies evolve. One of those is the National Autism Strategy, and as we've discussed throughout the conference and will continue to do so, we are expecting an update on the National Autism Strategy in the coming months. And Bill S-203 really places a pivotal emphasis on the accessibility of resources across the country. And having up-to-date information on the current state of autism services is essential to inform the development and, importantly, the implementation of a National Autism Strategy. So what did we do here? Our main goals were to review and compare access to publicly funded health-related autism programs and services in Canadian provinces and territories. And in doing that, to identify gaps and inequities in service provision. So what's out there? What can autistic people access in terms of support across their lives and in these different provinces? And a key part of this is the focus on the health piece. We acknowledge the importance of education and employment and all these different facets, and we'll touch on that later. But for this specifically, we narrowed our scope into health programs and services. And how did we do this? So our methods. We used two complementary methods. The first was a document scan. So I joked about the scan of the literature or the internet. That was kind of what we did. We went on government websites from all the different provinces and territories in Canada and basically searched autism programs, autism services, to try and see what all is out there. So we collected documents relative to autism programs and services on all provincial and territory government websites. But the second part of this process, which has been very enjoyable for Alexia and myself, are interviews that we did with non-government representatives of each province and territory, people who have leadership in autism organizations. So these are folks who know what's happening on the ground. What do people actually have access to? Is what's online actually what's happening day to day? Are there bits and pieces that we actually don't know about? And that's where things get interesting.
And so what did we find? First, we found that the programs and services that we identified, although they were relevant to health, could be found in different ministries or departments. It could be health, it could be children, it could be family, it could be community, it could be social services. There was a wide range. And we found two main funding modes. Either the people and the families could have access to the services directly, or they would be given funds that they could then use to access services and pay for them. Overall, the main result is every province and territory has challenges, clearly. And there are a few things that were really overarching that we found everywhere, and that's what I'm going to present to you, just the main big themes, high-level kind of summary, because there's a lot of data that we collected there. The first one was a lack of accessibility of the information. So when we went online and we scanned for document, we found that a lot of the information available was either incomplete or inaccurate or hard to find, and that's obviously a huge limitation. And the second thing is that even given the information that we found, when we then held our interviews, we found that there was a lot of inconsistency and that the online information didn't always reflect the real life experiences of people. What this tells us is that, you know, if families and autistic people go online to look for their information, it's crucial that information on websites is accurate, and if it is not, it is a problem to, like, well, it is an accessibility problem. The second thing is that this point might be even more important for autistic people or for neurodiverse family members that may be navigating the system and that needs accurate information available. The second theme we called falling off the cliff, and this is about adults. All provinces and territories reported big gaps in adult services, and that's diagnosis, but also services post-diagnosis. Although, like, diagnostic services was a huge problem, there are very, very few places in the country where you can get a publicly funded diagnosis, autism diagnosis as an adult. What this tells us is that autistic adults are left behind in programs and services in Canada, which complicates the transition to adulthood, because when a child grows up and turns 18 or 21, they lose access to a lot of the services that they had, and they have very little resources. The other thing is that some of the services that do exist rely on a diagnosis, require a diagnosis, and so if you cannot access the diagnosis as an adult, then you cannot access the services that you may need. The third theme was the long wait list. So when services do exist, they're usually subject to long waiting times, and that can go from a few months to years for certain services, which is a huge problem, and this applies to diagnosis, but also to other services that we've identified. This is another accessibility issues, right? Delayed diagnosis and long wait times make it really hard to access the services that exist. And some services need to be accessed at a specific time to be effective, or people may run out of the eligibility age period by the time they reach the end of the waiting list, which makes the service pretty much unusable. And the fourth theme, I'll let Maria
Yeah, I'll jump in. Our fourth main theme that we found relates to equity, diversity, and inclusion. So we call it EDI. We touched on this quite a bit in terms of intersectionality. EDI and intersectionality were very rarely considered in program delivery. And so when we talk about intersectionality, we're thinking about all the different identities that someone carries, right? For example, I was born and raised in Brazil. I'm queer. I am, as previously mentioned, neurospicy somewhere in there, right? And those are all things that I am as a person. And so these need to be considered together. The government is not currently considering this in program delivery to the extent that I think we would hope. And the nonprofit organizations are really trying to step up and fill this gap, which is very important to see. And the interviews really highlighted this because the original scan was really just a lack of EDI consideration. And another important element of this is that remote and isolated areas rarely have access to services without having to travel. So if you live in an area that's distant from a center, even though there is some level of online service delivery, there's conflicting information about how much people like to actually enjoy and take advantage of the services, but also just there's a lack of availability. So what we're seeing with this is that these vulnerable subgroups of the autistic community are being left behind. So again, some examples, the 2S LGBTQIA+ community, the queer community, and Indigenous people, both in terms of remote access to services, but also training and cultural competence and actually relevant to different communities and considerations that need to be accounted for in program delivery and implementation. So in conclusion here, there is insufficient support for the autistic community across the country. And as Deepa mentioned, this might not be very new information for most of us here, and we feel that way as well. But showing this in this way, again, what do you say, makes the obvious undeniable. But our next steps are, what is working? And for who, when, and where. So there are things that are out there. That is something that we did find. So identifying what is working is a great place to start. We need to evaluate these programs and services to make sure they're aligned with community priorities. This is key. And when identified, these programs that are meeting the needs need to be spread and scaled. So really investing to think that we know are working. And I mentioned this at the start, we really focused on health, but it is fundamental to scale this investigation into supports in employment, housing, and education sectors. And I would encourage all of you to take a look at our program. We have multiple sessions touching on these different topics that are going to be key in the next day or so. So yeah, that's it for us. We're actually going to hold questions until after Angela's presentation, but thank you so much for your attention.
Thank you.
Thank you so much for that great presentation. You know, as I was listening to this and seeing all the nods across the audience, these issues are so well known to us. And one of the things that we are doing at the Alliance that we do well is to make this information known to policymakers, decision makers who don't know these issues the way we do in this room, and to the Canadian public who assume that all of these rights are being met in the way that they should be. So this is a really important project that's coming out. We would love to have our members help disseminate the work when it's ready for report and publication. And so we look forward to the next steps in working with all of you. All right.
I'm like a single person presenting, so I'll just use the mic here. All right, so for those of you who don't know me, my name is Angela McDonald-Prejean, and I am a Data to Policy Fellow with the Autism Alliance, as well as I'm currently finishing my PhD at McGill University, and most of my research revolves around, when I'm not doing work with the Alliance, AAC, communication for non-speaking autistic people. All right. So the NAWI team, so that's what I'll refer to it as going forward. It's myself, Marina as well, who's sitting there, Simone Daniel, a research assistant here with the Alliance, as well as Dr. Single and Dr. Melanie Penner, who's a part of the Holland Bloor Review Research Institute and just got here. She's just like in the front row, and it's like the first time we've met in person, and it's really awesome. So I'm glad you're here. Exactly, she is wonderful. So to kind of position NAWI and how it came to be, because it's like kind of a little bit of a story. So at the Autism Alliance of Canada, there's something called the Autism Data Collaborative. And what that is it is a pan-Canadian group composed of autistic people, family members, researchers, policymakers, service providers, just many, many stakeholders in the autism community. And the guiding principles for the Autism Data Collaborative are three of the following. One is research and data are key into creating good policy. Autistic people and their families should be in the driver's seat and should be there for setting all priorities around research and policy making. And finally, collaboration and alignment across sectors and provinces are essential for achieving long-lasting, meaningful change. And I think that kind of echoes lots of the sentiments that's been passed through the panels over the past day and a half. Now, this collective identified 4 key priorities, and one of them was wait times for autism diagnosis. And you might be wondering why, and I know it's like a very obvious, again, thing of like, of course, we know why it was identified a priority, but just to kind of go over the quick Coles Notes version of this. So diagnosis at this time is still often needed to access important services and support. So it's kind of like that gateway, that opening door piece. And the wait lists, when the services are available for diagnosis, are very long. And importantly, there's no national data to show the urgency of this situation. And finally, there's no national dialogues on how to define and track wait times, leading to differences from province to province, site to site. So it's really hard because then we can't actually talk about and illustrate what's going on the national level. So, the Autism Data Collaborative, with the leadership of DEPA, came up with this initiative called the National Autism Waitlist Initiative. And I joined the team in October 2022 as a Data to Policy Fellow. And DEPA, along with the guidance and support of Dr. Penner, secured an initial pilot grant through CIHR to kind of get this initiative rolling. So when I started my fellowship, I was trying to think about how big this would be, and it's such a large, big initiative, but I was like, what's a meaningful project that I could do to contribute? And like we were talking about today, the main thing is about, now that we were talking, it's now time to implement and move to action. So I started off, because of my background, familiarizing myself with the literature, just seeing what's already out there, because we don't want to reinvent the wheel. Then importantly, I went back and re-engaged the ADC membership, just trying to get more information about why they identified this as a priority, and talking about and asking them, based on their experiences, essentially, what are the factors that you think make wait times longer or be more efficient? And then importantly, because I'm a data to policy fellow, emphasis on the data, is how can we track these factors using data, right? Because it always comes back to that. Then in tandem, I started to have multiple one-on-one conversations with various autism diagnostic site leaders across the country, because it's very important to bring them into the conversation as well. So that's where we kind of landed on this initial, I will say initial inaugural NAWI study, hopefully one of many. And it's called Defining Key Waitlist Terms, and it's currently in progress. It doesn't have like the most stunning, catchy title. I think we need to go through comms committee a little bit, but either way, here it is. And there's 3 objectives. One is bring together individuals with lived and professional experience with the autism diagnostic process from across Canada. And second, as a group, have this group create clear and consistent definitions for key waitlist terms that we use to talk about the autism diagnosis process. Because as I'd mentioned, there is differences, unlike, for example, when someone says, oh, my wait time is this long, well, they measure wait time slightly different. Therefore, we can't really understand when we say wait time, what do you mean by wait time? And finally, understand the reasons why or why not an autism diagnostic service would use or not use newly created or standardized definitions, because there may be some barriers or facilitators to that would be extremely important to uncover. So, thinking about the context, where we're starting at is we're looking at publicly funded autism diagnostic services for child and youth, and I want to mention why, because I know that there's, in the previous presentation, Marina and Alexia so beautifully illustrated that adult services are falling off the cliff, and currently in the public sector, autism diagnostic services are very limited, but with the idea that we just kind of want to get things rolling, our initial focus is on autism diagnostic services for child and youth, But, however, the idea would be that the findings from the study would be very applicable for when, not if, when adult services in the public sector for diagnostics becomes more widely available. So, how are we going to do all these things? So, bringing all these participants together, first we're going to have them individually define 5 key terms that are associated with wait lists. For example, one of them might be date of referral, like I spoke about before, wait time, date of first appointment. And then after they do these things individually, they're going to come together and we're going to get them to attempt to agree on one way to define each of these 5 terms. And we have a process, and I could speak about it, those of you interested in it. It's basically an anonymous and structured voting procedure that we're going to use to try to achieve consensus. And then once that's done, we're going to be getting the site leaders to individually fill out a questionnaire that's related to, again, barriers and facilitators to them using these newly created definitions, because that's kind of when the rubber meets the road. We can get together, we can create these definitions and go sing kind of kumbaya, but like what will make a difference is kind of understanding, will they actually go out and use these definitions at their site? So, progress to date is the protocol is written and the ethics are approved, which sounds like it's just like 2 lines, but it was like a lot of work. All for the researchers in the room, I can see nodding. And right now, in progress is recruiting participants, hoping to wrap that up in the next week or so. And we're also in tandem collecting some initial data, which is really exciting. Now, the potential impact is that we could have consistent definitions and then in turn have consistent waitlist information, which is great, because then it doesn't matter what province or site you're in, when someone says it's a wait time, you know what they're talking about. And then that could be used, especially in this group, for clear and united advocacy, because I think that's one of the big take-home messages today. And then finally, in particular for this one area that we really need to push more forward on is to have positive and meaningful changes to the autism diagnostic services in Canada. So thank you for your attention, and I think we will change it over to questions. I don't know. I'll let Deepa do it. Anyway.
Thanks so much, Angela. I do want to acknowledge Dr. Penner for her clinical leadership in this area. It really does take a clinical champion to help and recruit people who are working and living and working within the healthcare system. And we're going to push everyone, because not only do we want to talk about how to collect this information, but we want to actually get them to agree to report this information in a publicly transparent manner, which is going to take a lot. But together, we are going to push for that information to be available so that we can have these conversations at the national level, and that the issues that our clinicians are facing and the barriers that they're facing to help the families that they are dedicated to serving start to get addressed. And so thank you so much for your clinical leadership and being a champion for us in this. It's a great team. And we are open. We have a bit of time for questions. So we are open to questions. I apologize, but you're going to have to use Slido. And I'm going to have to get that iPad back so I can see the questions that are coming in. And there it is. So one of the questions is, what is the timeline to actually see a difference made in wait times with these projects? And that is a really great question that I wish I had an answer to. So, you know, these are the incremental steps that we're taking and that we're really proud to be taking, because it hasn't really been done at this level before. And so as we take them, we will absolutely feed the information back to all of you about progress and where we're at in our progress in this initiative. This is a great question. So for the waitlist project, is mostly the clinical leads that are being invited to participate, or the operational leads, often the ones managing the intake and scheduling involved? Great question, and yes, the operational leads are absolutely being invited to participate in this project. One more question, Jonathan's signaling to me. I love it when he does that. Question. Okay, I'm going to end on a high note. Not a question, I just want to say both projects are so important and incredible, and please keep up the great work. Thank you for acknowledging that. It does really help keep everyone motivated to continue onwards. So thank you so much to our panelists and our team and all of you.
Thank you, everyone. So I hope this morning was able to ride really on A from Tanya, action, right? We're looking at implementation today, and but what we can take from these products and really helping think about what we want to do as a community, taking some of these outputs back, going back to your regions, and working and advocating with local governments, local whatever space you find yourself to be able to do that. So this afternoon is going to be more of that. We've talked about this a little bit. So lunch is coming, but before that, let me explain. We're going to have a workshop led by Springboard. When you return from lunch, so there's going to be tables with labels on them based on your region, okay? And you're going to have to join a table that corresponds with your region, your province, your territory. Each table will have that sign out there. We talk about accessibility a lot, and one thing a colleague of ours from another disability group mentioned one time, and it stuck with me, is part of accessibility is patience. You know, we have to wait for one another, and I know when we come back into this room and we have to take our stuff and move around, find the right table, it's work, and we're going to have to be patient with one another. We're coming from lunch. We got to cut our good conversations off sometimes, and that seems to be my job a lot during these 3 days. But to be able to move to the right table, find our space, find the right ways that we can access and participate as fully as we want to or can in this afternoon session. So you will be at a table, and there's going to be a facilitator at each table. They're going to guide you through the exercise. There's going to be a workbook, and you're going to work with the peers at that table to discuss specific questions. So most of the engagement at these tables will be conducted verbally. However, if you feel more comfortable engaging with your group through typing on a Google Doc, feel free to do that. There are going to be specifically 3 tables that will have a hybrid setup where you can both contribute verbally and on Google Docs if that's the way you prefer to contribute. A lot of logistics around that, so again, for accessibility reasons, please be patient with our teams as we try to set this up with all 250 in the room. So if you are a volunteer, please feel free to meet by the stage at 1:15 if you have any questions, and just to orient and just feel grounded as we move into this. We are looking for additional volunteers. If you're interested in help taking notes, facilitating a table discussion. Again, we heard about the values this morning. Part of it is have fun. So if this is something you enjoy doing, you feel like you can contribute in it, we would love to have you as part of this. So please come at 1:15 to the front after lunch. And with that, we'll see you after lunch. Thanks. It is. Appreciate those, and those online who are joining all the way from the West Coast where the sun just rose. And not that it's really nice here anyways, but thanks. It's raining over here in Ottawa. Yeah.